Hi, good evening, Steve Adler. Got a minute? All right, let's go through some numbers today. Um, we'll talk about schools a little bit more and what Dr. Escott, our health authority, ordered today in reaction of AISD. We'll also talk about what mayors are doing with respect to the governor around the state. But first, let's take a look at the numbers. We're going to begin with hospitalizations, new admissions. You can see that the number is 74. That is pretty close to our 7-day moving average, which has seemed to have plateaued at just about 70. You look at that color chart that has us right on the edge between orange and red. You can see again what this increase was in hospitalizations and how quickly in such a short period of time we went from yellow all the way up into that kind of buffer area between orange and red shows as red on this chart. Just how fast that happened. If that line had been allowed to continue, it would have been off the page by now. So again, thank you to the community for stepping up. We have to maintain this. We have to redouble efforts. We're still not anywhere near out of the woods. We're still on the edge. But it does look like more and more that this may be plateauing. It's important to remember that we have not seen hospital admissions, if there are any, spike associated with the July 4th weekend. Probably the end of this week. We should just start seeing an impact or a surge if there is such thing. Let's hope that not too many people did barbecues with the neighbors and the community in their backyard over July 4th weekend, because if they did, we'll see a spike. You can't hide things from the virus. The virus doesn't close its eyes. But anyhow, that's the number. Look at the other side of this chart. New cases today, 553. That is a little above our 7-day moving average of 512. Recall yesterday we were at 657. We thought some of those numbers might have been a result of the weekend. But here we are kind of firmly in an increasing number of cases in our city. We have to continue to watch that. The demographics show that a lot of those are younger people. They recover more quickly, even though correlation between increase in younger populations results ultimately in an increase in other age groups, in part because it's a sign that there's increased infection in the community that then passes on to other people. The mint colored numbers at the bottom of the page, the total, this is not the daily count of hospitalized. This is the total number in our hospitals. The 7-day running average is 448. The number we actually have hospitalized tonight is 469. So we're still on that upward trend. If the current number is larger than the 7-day running average, then you have a line that is continuing to go up. ICUs is the greatest concern that we have, because that's where our staffing issues are going to show up, if they show up. And ICUs up at 154. That's the number that's up from yesterday's number of 151. N at 154. That's substantially higher than our 7-day running average, which you can see is 143. That's still the concern. So even though we're plateauing, we're still seeing this upward push for ICUs. If we run into troubles, that's the first place that we're going to see it. That's where they're having troubles right now, in Houston and certainly down in the valley. And San Antonio is looking at these numbers pretty much the same way we are. Ventilators, 89 people. 92 people. 89 is the 7-day running average. 92 is the number of people that are actually on ventilators in our intensive care units right now. Again, that number is higher than the 7-day running average. That's why we're not out of the woods. That's why we're still on the edge. We have to hold on to that plateau. We can't lose discipline. And in fact, if we want to be able to have a better chance of knowing we can sustain businesses and the like, we really need to push down the total amount of virus that's in our city. We would do that by even doing a better job than what we're doing right now. Let's go to the next page. This is the other page from the dashboard. Shows you the total number of cases. Total number of cases in the city with the additional 553 gets us to new cases of, we don't have the dashboard quite yet. I'm sure it's coming in just a second. Here it is, 15,998. The number is tiny, but you can see it. There it is, 15,998 cases. We have deaths of 179. That is 7 more people than we had yesterday. As we increase the number of people, we're going to increase the number of people that pass away. 7 more families. Our thoughts and prayers go to them this evening. The numbers in green are the daily census counts that we went over earlier. So those are the numbers today. We maintain that plateau. We can't let up. We have to be worried about July 4th. And even at this slow rate, our ICUs are going to run into challenges eventually. But there are other cities in the state that are advancing at a higher rate right now than we are. Houston is seeing that. The Houston mayor, Sylvester Turner, joined by the Harris County judge, today continued their call for the governor to go to a shelter in place in Houston and Harris County, at least for 2 weeks, to drive down the amount of virus that's in the community. We talked about that before as a possibility to lower the virus, to increase the chances that schools could open to a larger number of students and to sustain. 4 judges in the Valley today asked, and I think it was 4 county judges in the Rio Grande Valley also joined in the call, asking Governor Abbott for the ability to have local control on these issues. That's the same request that I have made and Judge Bisco has made here in Austin and Travis County, so that we have tools in the event that we could use them. Our health authority, Dr. Escott, believes that we would be in a better place right now if we would go back to phase 1. Phase 1 is pretty much where we're living right now, except it takes restaurants and retail back to 25%, just so as to decrease the number of people that are together, still keeping curbside and takeout and outdoor dining, but trying to lower the size of groups that we're seeing in the city. Speaking of schools, Dr. Escott spoke today to the Travis County Commissioners Court, presented a slide deck. I'm going to show you 3 of his slides, including something that he said today that has sparked conversation relating to schools, as he was trying just to explain numbers. So let's look at the first slide. He began by talking about the number of kids that are in school. And you can see we have about 192,000 kids that will be going to school here just in Travis County. In addition to that, we have just under 10,000 teachers. But focusing on the school number of students, 192,000. He was trying to answer the question he's heard that children aren't at risk. And it's true that in our city we haven't seen a death of a school-age child, but we haven't had very many get infected either. So we don't have a large pool. But when you look at the infection over a large group, you'll find that while the percentages may be lower, If the group is large enough, you have deaths in every one of the age groups. He looked at a large group like this and he said, when you have a mortality rate for children between 10 and 19, which is low, he said the range based on the best available evidence of mortality in that range is like 0.03%, all the way up to 0.1% in that range, which is a very small percent. And people would know that they could send their child to school and say that there's a 99% chance that nothing would happen, even better than that. But when you take 192,000 kids, what he said was that statistically from that pool, if they were just gathering the way that people gather in the community in regular classrooms, regular education, the way we've always done it, that you would expect to have probably between 40 and I think he said somewhere between 40 and 1,300 students would pass away because of the virus. And that's a number that you reach statistically based on the mortality rate. It's not a big number of students relative to the total number of students, but that's a huge number when you think about loss of life and individual students. So what do you do with respect to schools? Schools are hard. Let's go to the next slide. When he was talking about schools and students, he said, students have a lower risk of serious illness and death, but a higher likelihood of transmission because of their interactions. They don't social distance the way that adults might. When you look at faculty and staff in the classroom, higher risk of serious illness and death because teachers are older and statistically will have higher percentages of getting infected and having issues. But at the same time, they're more likely to be able to engage in protective behaviors and social distancing and wearing face coverings. The challenges with respect to schools is that if you start schools and then teachers start getting sick, you have staff shortages. You put in a position of going kind of on and off. Federal funding for mitigation and testing and the like has been real limited. We can't do the kind of testing. It's not scalable to effectively exclude sick people from being in the population that's in school. And for all of these reasons, our health authority, Dr. Escott, ordered today that schools should not start before Labor Day. If you'll go to the next slide, Anita. Delay the start of school, or schools can offer virtual education at least until September 8th. The time between now and September 8th will give us a chance to really evaluate with the school districts what's appropriate and what is in the best interest of the students and the teachers and the community generally. Taking a look at the CDC and the TEA requirements, see if we could refine them, make them applicable to our situation here in Austin and Travis County. But he said as a default position, people need to be starting to think about the fall being a virtual instruction period of time. There are schools, obviously a huge issue on lots of different levels, and there are a lot of aspects of that. Parents want their children in school because they want to make sure that they get the education that they would be getting in school, the socialization they would be getting in school. If they're not at school and if they're virtual learning and not learning as well, then a gap compared to what they would have learned gets created. From what I've seen, most of the experts say that most of those students will make up that gap. And it's not something that is with them the rest of their lives. But there are some students that have special needs where that kind of gap can have a bigger factor. I know there's some parents that are trying to figure out what happens in school so they know how they can go back to their job. It makes it very hard to work if your kids aren't at school. That's an incredible inconvenience. and not to minimize that at all, because I know it is huge. Dealing with my daughter and her husband and their two grandkids who've been with us here now for the last since March. I know the issues are very, very real. In a pandemic like this, where people's lives are at stake, probably that element of convenience doesn't weigh as high as some of the life and death health issues. But there are some children that probably need to get to school. Certainly essential workers, workers that can't otherwise find or afford childcare. So these are not easy issues. I think that one of the things being looked at is saying, well, how do we open schools safely while there's still a significant amount of viral load in the city? So ideas discussed. This is not a program or a plan, but something that says, hey, instead of having 24 kids in a classroom, what if we decrease the occupancy in schools to the same 25% that is phase one for restaurants and retail? So instead of a class of 24, you'd have a class of 6 students. We've seen some of the child care operations in our city that you might very well be able to do that safely. And maybe those 25% slots need to be held open to those kids that have special needs, extraordinary situations that really require that they be in school. That rises to the same kind of level as making a medical decision for someone. You could do something like that, and bus drivers and custodians could still be employed. But those are the kinds of issues that'll be talked through. The only thing that happened today was Dr. Escott said the classes, while they could start virtually, no in-person class, at least until September 8th, giving time for this to be studied and to be talked about. But certainly he was telling people, we called it a default assumption, he was getting people at least ready for the possibility that there might not be in-person school, or at least for the general community, going into the fall. Superintendent Cruz here in AISD then sent out an email to his community telling them that he is suspending in-person education for the first 3 weeks of the school year. Dr. Escott's order, I believe, delays extracurricular activities, sports activities, and the like in the schools for the same period of time. Tomorrow we're going to talk about education some more. I had Dr. Cruz on. I'm going to give us a chance to hear from the teacher's perspective tomorrow evening as well. This is still, we need to hold our edge. We're still trying to keep the community safe. Austin Public Health is inviting the community to participate in a virtual forum this weekend. It's about COVID-19 and the African American community. Our neighbors of color have been profoundly impacted by this virus. The City of Austin is working hard to try to address that challenge and those outbreaks. So there's a Facebook Live event. It's going to be Saturday, July 18th at 10 a.m. on Austin Public Health's Facebook page. Urge everybody to go there. There's going to be a community panel. You can get answers to your questions live. Hear the questions and answers from other folks. You can provide us input, which would be needed on how we can improve things. I want everybody to remember to spread the word about the Pandemic Electronic Benefit Transfer Program. That's the P-EBT program. Notice this is for kids that are eligible for free or reduced price meals during last school year. You can get free meals now. And a large percentage of folks that are eligible for this benefit are not claiming it. The deadline has been extended till July 30th. I urge everybody that's eligible to go. If you know some folks that might be, make sure that they know about it. And the way to apply for it is what we see right here on the banner. Keep hearing rumors that we may be hearing something from the state. To me, they're just rumors at this point. But let's see. In the meantime, we just need to focus on taking care of ourselves. Again, thank you to the community for what you've done. Everybody should be proud of what we've done with that line. Can't let up. Keep your foot on the brake. All right, we're going to close with mailbag tonight. We got some great pictures from another Austin family. You hear the expression that good fences make good neighbors. Old fences make good neighbors too. They can bring people together. Here are siblings: Magnolia 9, Matthias 7, Lilia 7. They're siblings at Blanton Elementary. They are passing the time by painting birdhouses that their neighbor made with scrap of wood from a recent fence repair. This is some really cute upcycling guys from fence work making the birdhouses. Pretty cute. And if you miss a fine dining experience as you're at home and not going out as much as you used to, if you miss it and you happen to be their parents or their brother, then Lila or Lilia and Magnolia have opened the Unicorn Cafe, which operates only once every 2 months in the kitchen in their home or for special occasions, from 7 to 9 a.m. in their East Austin kitchen. Sounds like a pretty cool new breakfast spot in town, pretty exclusive. Thanks, guys, for sending me your pictures. Please keep the great photos coming in. And with that, everybody have a good evening, good night. Take care of yourself, and please be safe.